The FDA has issued an emergency use authorization, and the CDC has approved the vaccine for kids age 5 to 11, which is fantastic news. I often get asked, why vaccinate this age group? They don't get COVID, and that's just not true. While it is true that the vast majority of kids do very well with COVID, low risk isn't no risk, and these kids can have bad outcomes. In fact, there's some recent data that just came out that showed that up to 30% of children who have been admitted to the hospital with COVID-19 had no underlying risk factors for severe disease, and yet they ended up in the hospital, and at least half of them ended up in the ICU. So that's concerning because that means there's a subset of children that are getting severe disease for reasons we don't have the answers to. The other data that the CDC just released shows that COVID-19 is now the 8th largest killer of children. It's ranked 8th. Kids are dying from this, and not just kids who have significant underlying medical conditions. So I think that in and of itself says why we should vaccinate these children. I mean, it's low risk and no risk just are not the same thing. And with no way to predict who's going to have a bad outcome, protecting everyone is the best way to prevent, awful things from happening. When you look at the data in children, it's very clear that the risk of a negative outcome from an infection with COVID is much, much higher than the risk of a negative outcome from the vaccine, mostly because the risk of a negative outcome from the vaccine is extremely, extremely low. It's like 1 in a million type risk, whereas COVID, the risk is just so much higher. So it's definitely in the risk-benefit ratio, it is definitely more prudent to get the vaccine than to take that risk with your child. It is true that the vast majority of kids will do well with COVID. In fact, about 50% will be asymptomatic. They won't even have any significant symptoms that you would recognize. Then about 30 to 40% will be symptomatic, but will be mild enough that they'll be able to stay at home. Then another 10 to 20% are going to be sick enough to need to be in the hospital. So when kids get admitted to the hospital with COVID, it can be for a variety of reasons. Some maybe only need a day or two in the hospital for IV fluids, maybe a touch of oxygen. They just need that little bit of supportive care and then they do fine. Other kids need IV antibiotics. They need IV antiviral medicine like remdesivir because they're more significantly affected or they have more serious underlying medical conditions. And then you have those kids that really struggle to breathe. They get bad COVID pneumonia. They need to be in the ICU. And certainly kids have been on ventilators. And even here at Rainbow, we've had kids that have needed to go on heart and lung bypass machines because of how severe their COVID is. And everything that we're talking about doesn't even include those kids who go on to have long-haul COVID. So believe it or not, kids with even very mild symptoms can end up developing what we call COVID long-haul syndrome, which is a syndrome where they start to develop very severe and even debilitating fatigue. They can have brain fog. They can have chronic gastrointestinal problems. They can start to develop migraines. All sorts of medical problems can come out of this. And this COVID long haul can last for months, probably even years. It's too early to tell. And kids, even with very mild COVID, can have this. And it looks like it's going to be somewhere in the range of like 5 to 10% of kids with COVID go on to be long haulers. And it's very devastating. I do the COVID recovery clinic here, and watching these kids, some of them are young, and teenagers just lose their ability to function, lose their ability to go to school, interact with their friends, lose their ability to play extracurricular sports. It's heartbreaking to watch what these kids are going through. And we know that the vaccine could prevent that from happening. And to me, that's the number one reason to get vaccinated. Side effects from the vaccine are usually mild and self-limited, and it's the kind of things that you would expect. Think about other vaccines you've had, like the flu vaccine or measles vaccine. Headache, arm pain, redness at the site of injection, maybe a little muscle pain where the injection went in. And then you can get some fatigue. Very rarely we see things like low-grade fever, feeling unwell for a day or two, but these usually resolve within 24 to 48 hours. The three biggest reasons that I hear that parents aren't vaccinating their kids, the primary one that I hear is they're worried about their child's fertility. There's a lot of rumors circulating on the internet that the vaccine can affect short-term or long-term fertility, and that's absolutely not true. There's no science behind that. There's no data behind that. And in fact, there's very good data from people who've already been vaccinated that their fertility is perfectly intact. The second reason is the inflammation of the heart, or myocarditis. We saw this with teenagers who got vaccinated after the vaccine was released for kids who are 12 and up. There were no reported cases of myocarditis in the 5 to 11 trial. However, we do know that it's an extremely rare side effect, so it is possible that it's simple that the study wasn't large enough to capture it. And the other thing that I will point out is now we know it's very clear that the myocarditis that comes as a side effect from the vaccine is extremely, extremely mild, typically resolves within 24 to 48 hours, and does not appear to lead to any long-term health problems either with the heart or with anything else. The last reason that I hear from parents that they don't want to vaccinate their kid is this mysterious unknown. What if 5 years from now some side effect emerges from the vaccine that we didn't know about, and I already injected my kid, and now 5 years later they're going to have cancer or some other thing that I didn't know about? And that's understandable. I understand why parents have that fear of the unknown, but it's not scientifically or biologically logical. The vaccine, any vaccine that you give yourself or your child, only stays in your body for a few hours to a day or two, and then it's gone. It's been completely eliminated. So there's no mechanism for it to have ongoing effects on the body after that initial exposure. So any side effect that's going to emerge from a vaccine will emerge in the first 4 to 6 weeks. It cannot emerge after that because the vaccine itself no longer exists inside your body. A lot of people have raised concerns about the speed with which the trial was conducted, and their concerns that means that there were shortcuts taken in the science. It's interesting, though, because what we actually saw was what science can do when everyone works together. There were no shortcuts taken in the science. The shortcuts that were taken were in the bureaucracy, were in the logistics of setting up the trial and conducting the trial. And so what we saw was this amazing coming together of all sorts of different groups of people to make these trials move faster than they otherwise would have moved. Not scientifically. The science was solid, and the science has followed the same pathway that every other vaccine trial has ever followed. But where the shortcuts were in things like setting up the clinical trial sites. So we know, for instance, that the HIV Research Network volunteered some of their resources to help with the vaccine trials, which normally would not happen, but it really helped speed up the process. And the other thing was the volunteers. People volunteered in huge numbers to be in the trials. So normally these companies spend months and months and months recruiting people to be in their trials. In this case, most recruitment sites shut down within a couple of weeks because they recruited their full contingent of patients so quickly. And so what actually happened was just an amazing testament to what we can accomplish when we work together. And it kind of makes me sad that people turn that around and say, oh, it must mean that the trial was not as good. In reality, the trial was fantastic. And normally you wouldn't see that with vaccines because you're not under the pressure that a pandemic puts you under. It's more of a routine illness that affects a small number of people. And so you have time, and you're not going to get that kind of outpouring of resources to make the trial move faster, which is why the trials move so slowly. But in this case, because of the massive number of people dying and being in a global pandemic, universities, governments, private industry were just pouring money and resources into these trials, and it really helped move things along quicker. Again, the bureaucratic and logistical side of things moved quicker, not the science. When a vaccine is approved for adults and then they need to study it in children, the very first thing that they do is what we call a dose trial. And this is where you take a small number of children of various weights and sizes and ages, and you test a couple of different doses in them to see what dose gives you good immunologic response with a minimal of side effects. And then after you do the dose study, then you take that dose and you apply it to a larger population of children to make sure that same dose has the same response in a variety of children, and they did that. So it was a 2-phase trial, which is standard in pediatrics. There's nothing different about that than in any other pediatric trial, and they found for Pfizer that this 10 microgram dosing, so it's a third of the adult dose, works very well in children, gives you the same level of protection, but at that lower dose. So basically what's in the vaccine is mRNA, this messenger RNA, and it's wrapped in a lipid envelope. And those lipids have funny technical scientific names, but all it is fat molecules. So you're looking at messenger RNA, which is something that's naturally occurring inside of our cells, wrapped in fat, which is something that's naturally occurring inside of our cells. So the ingredient list is very short and very easy. The job of messenger RNA is to tell the cell what proteins to make. So our whole body and everything that it does is built from proteins. And different cells make these different proteins. And what messenger RNA does is it tells the cells, hey, make this protein, make that protein. So what the messenger RNA in the vaccine is doing is it's telling the cells here in your arm muscles to make the spike protein of the SARS-CoV-2 virus. That spike protein is recognized by your immune system as not being self. And that's what the immune system does, is it differentiates between self and not self. And when it sees not self, i.e. these free-floating spike proteins, it attacks it. And after attacking it, it stores that information away in its memory and says, hey, whenever that comes along, it's bad. So then if you're vaccinated and you get exposed to the SARS-CoV-2 virus, your immune system can say, oh, I know that, that's bad, and it'll attack it much quicker than it would have done if it had to learn it first. And so you don't even know that you've been exposed or that the virus is anywhere in your body. The immune system fights it off and you're good to go. So the vaccine does not contain any live SARS-CoV-2 virus, nor does the mRNA contain instructions for making an entire working viral particle. So the vaccine cannot cause you to shed the active virus. That's not physically possible. The only situation in which I would consider potentially not vaccinating my child is if my child had very severe allergies to a wide range of drugs and other vaccines. In that case, I would probably talk to my allergist first and make the decision together with my doctor as to whether I would vaccinate my child. Outside of that, there is no child that should not be vaccinated for SARS-CoV-2 because it's such a good vaccine and it works so well. We should be protecting all the kids, even kids who have been infected before. We do not know how well that immunity lasts, and in adults it doesn't last very long at all. And this vaccine is so safe, I would simply vaccinate any child, even if they've had COVID before.